Motivational interviewing is a collaborative, person-centered approach to conversation designed to enhance an individual's motivation to change by exploring and resolving ambivalence. In this scene, you'll see Dana talking with Joanna, her therapist. Dana and Joanna have worked together for months as part of the care Dana is receiving for her substance use disorder. Dana has something she wants to talk to Joanna about, and Joanna will respond using motivational interviewing techniques.
Well, what else would you like to talk about today?
Well, I actually have something big I want to talk to you about. I've been thinking about it for a long time, and I feel like I'm ready to get pregnant.
That can certainly be a big thing to think about. What led you to consider planning pregnancy at this point in your life?
I've always wanted to be a mom. I think having a baby will give me a reason to stop using for good. I know I can do it once I get pregnant.
It's clear that becoming a mother is very important to you and that you believe having a baby will motivate you to stop using. Let's see, can you share more about what excites you and worries you about becoming a parent?
Yeah. I mean, the idea of having a baby is exciting, and getting to raise them and watch them grow up is something I've always wanted. I really want to create a family. If I think about what worries me, I guess it is my use. I think I can stop when I'm pregnant, but there's a chance I won't.
It sounds like you have a strong desire to create a family, and that having a baby is a big part of that desire. It's also important to acknowledge the challenges you're facing with substance use. What do you think might make it difficult to stop using once you're pregnant?
I guess just the stress of being pregnant on top of just normal life. I know it's not easy. I've seen enough of my friends have babies, and I know it's hard. I've never had to do something like that before, something that big.
It really makes sense that you feel both determined and unsure. You're hopeful that pregnancy will give you the motivation to stop using, and you're also aware of the stress and challenges that come with it, which is really insightful. What has helped you manage stress and stay sober, even for short periods in the past?
When I'm busy with something I care about, like my art projects, and I like my job right now, so working helps. I like having a schedule and a routine, so knowing I have to be at work on a certain day and time, I feel like it helps me to stay on track. But I've never had something as big as a baby to motivate me.
I hear you identifying some important things that have helped. One is staying engaged with something you're passionate about, like your art, and that you enjoy your job and the routine of a work schedule helps you. I can understand why those things are valuable in staying sober. What else do you think you can do before you get pregnant that would help you stay sober?
Maybe I could get more involved in art, like take a class maybe. That would give me more to add to my schedule other than work. My boss said I can add some hours onto my schedule if I want. I guess all those things would help some, but it's hard to imagine without the baby as a reason.
Taking steps to stay sober and stop using long-term can help you prepare for the future you want. What small steps do you think you could take right now to work towards your goal of sobriety and becoming a parent?
I guess I could start by going to more support groups. I'm not going to know what it's like to be pregnant, but I could talk with my friends who are parents about what it was like for them and what they did to deal with the stress and what they do to deal with it now that they have kids.
That all sounds like a positive plan. How can I support you in taking these next steps?
Motivational interviewing techniques such as exploring ambivalence, open-ended questions, affirmations, reflective listening, and summarizing can help navigate even the most difficult conversations. Using these techniques can help providers meet patients where they are and limits the impact of opinions or biases the provider may have. By focusing on the patient's feelings and supporting their autonomy, individuals can feel empowered to take steps towards safety and well-being.